Hi, welcome to Your Health Matters. I'm Scott Kern. Do you want to learn about free mammograms? If you do, stay and watch today's show. We have a great guest. It's Teri Williams, our Catch It Early Program Director. So she's got a lot of great information to talk to us about free mammograms, how you can qualify, and where you can get them done here at KRMC. Stick around for today's show. It's going to be a lot of fun. We'll be right back after these messages. Hi, welcome back to Your Health Matters. I'm Scott Kern. We've got a great guest today. We have Teri Williams.
Hi, Scott.
Teri, thanks for being with us today.
Sure.
So, you run our Catch It Early program here at the hospital. What is Catch It Early?
Well, it's a program to educate women in the community about breast cancer, how common it is, and what we can do to not only prevent it and also, but how we can treat it, and it's so important that we catch it early.
That's true.
For treating it. And so, and then our program also helps women. It's about taking away every barrier we can in our community so that women can get in for screening. And so we help people who don't have insurance, or whose insurance has, if they have high deductibles or co-pays, we can help them with the costs. And so we're pretty excited that now we have put together grants and a lot of community donations and different ways that basically every woman over 40 will cover any out-of-pocket costs, so they can essentially have a free mammogram at KRMC.
So that's pretty insane. That's pretty cool to say that if you're over 40 and living in Kingman, the Mojave County area, or just Kingman?
Mojave County.
Mojave County. If you're living in the Mojave County area and you're over the age of 40, you can get a free mammogram.
Exactly.
If you qualify.
If you qualify.
If you qualify.
Well, and really the qualifications are if they're over 40, if they haven't had a mammogram in the previous 12 months, and that they have a local doctor that we can send the report to. And
oh, that's fantastic.
Yeah, so it's an amazing program.
That's a really cool program. It's a really neat feature to add to have. You should be excited. That's really cool. That really, I can see how that can really help a lot of women in this town. And by helping those women, you help all the children and their husbands. Because trust me, without you ladies, a lot of us guys would be lost. So
that's true.
We appreciate you trying to protect everyone and get them covered. So how long has the Catch It Early program been around?
We started the program in 2008, and since then, we first started in doing reduced cost mammograms. The other part of the program is we also provide a navigator. We have a grant from the National Breast Cancer Foundation where we have a lady by the name of Jennifer Rosebrock. I know she spoke on this program before. She helps women get in for the mammogram. She helps them get into the right program to cover the cost of mammograms. And then we also, she helps with if someone has a result, an abnormal result from their screening mammogram, she's there as a resource for those women. And it's pretty scary when if you are called back for additional testing, women are understandably afraid.
Absolutely.
And so they, but she's there as a resource. She helps kind of coordinate between all the different testing, answers questions. She's an advocate on that woman's behalf throughout the complicated medical system. And so she's just a resource to help them out. And then also helps with any of the barriers. Anything from if a woman doesn't have transportation to come in for tests, if they, whatever it is, we're going to find a way to make it as easy as possible on that woman.
That's very cool. So you said we've had this Catch It Early program around since 2008. Is that when you started with the hospital? Right before?
Prior to that,
Okay,
and we
so
started it with a grant from the from Susan Komen Foundation, and from there have grown the program. And then also, as we grow the program, a lot of community members and businesses and whatever have also contributed funds to help us keep it going.
So this has been your kind of your baby from the inception since 2008. So you've really seen it grow from the grassroots of working with Susan Komen and the National Breast Cancer Foundation to now. It's funny because it's been pretty cool since I've been here working with you. We've managed to turn October into a fun shade of pink all over the community.
Absolutely.
And the community involvement with the breast cancer awareness has been just a lot of fun. And that's the only way to really say it. It's fun to see how everyone gets behind it, gets involved with it, and shows their support. And it's given you a chance to team up with the city of Kingman also and other local businesses.
Absolutely. And it's interesting. I know I hear a lot of comments, well, there's other cancers other than breast cancer, and why is it all about pink stuff, and why so much emphasis on breast cancer and not other cancers? But I think it's important to know that, first of all, breast cancer is the most common cancer among women. 1 in 8 women get it. So most people relate or know someone who has breast cancer or had breast cancer, a mother, a daughter, a sister, a grandmother, whatever. And so people do rally around that because they're touched by it. So many people are. But what happens is as we have attention to breast cancer, other cancers and people who are suffering with other cancers also benefit. And a lot of our fundraising has to do with, even though it's pink, our fundraising has to do with raising funds for the Kingman Cancer Care Unit.
And they cover all
who
sorts of
provides resources and help for anyone with cancer in the community. And so it kind of is almost the breast cancer thing leads the way, but it rallies people to help with a lot of other cancers also. So
that's very cool.
So it is a neat thing, but with breast cancer and with our Catch It Early program, we are concerned with breast cancer. We have a high incidence of late-stage breast cancer in Mojave County.
Wow.
And we really need women to know that if you find it and catch it early, if you get regular screenings and it's found very early, it really is curable. And a lot of people hear the big C word, cancer, and they think it does. And they think, well, if I'm going to have cancer, I don't want to go through that treatment. If it's my time to go, I want to go. But unfortunately, if we can get it early, it's just not, it doesn't have to be a big deal to treat. And I'm one that can talk about that. I have breast cancer. I was diagnosed 2.5 years ago, and in my case, they caught it early, and my treatment, and as you know, my treatment was not, I didn't miss a day of work.
That's
and
true.
I wasn't sick, the treatment was very, very easy on me.
Innovative, I guess is the way to put it.
It was innovative. I had radiation therapy. I'd go in, and it's kind of a hassle because you got to go in every day and get a radiation treatment. But as far as any side effects, I had no side effects from that, and my cancer's gone, and so far, knock on wood, I'm still cancer-free. And now, I mean, honestly, breast cancer, it has a lot of drama around it. But again, if you can find it early and have it treated, 98% of women in early stage breast cancer go on to live full active lives.
Well, that brings us back to the free mammograms then. So if I can recap that one more time so we can let the public know how to work with this program and get a hold of this program. You just have to be over the age of 40. Now, is that the age the physicians recommend starting to get mammograms? I'm a guy, so I don't know these things. I have to ask these questions.
Yes.
Oh.
All women, the recommendations, everything from the American Cancer Society through Susan Komen, what the recommendation is that starting at age 40, women should start having their mammograms every year, and continue doing so as long as they can.
Okay, so you're over the age of 40. You cannot have had one over the past 12 months.
Right.
And what's the other? There's 3 qualifications. You just have to be a resident of Mojave County.
A resident of Mojave County.
Okay.
Yes.
Now, do you go see your physician, your provider?
Good question.
How do you how do you work with this program? How do you, as an individual, how do you take advantage of this program?
Well, what we need to clarify is how this program works. Is that we leverage with the state Medicaid. And then there's another program called the Well Woman Health Check Program. So women can call our imaging center at 692-2727.
692-2727.
Yes. And women can call. What we will do is we'll schedule them for the mammogram, but if they're uninsured, if they have no insurance, we will first try to get them into state Medicaid if they which is access, if their income is at that level. If they make too much for state Medicaid, then we try to get them into the Well Woman Health Check Program, which is another state-funded program that provides women's health services. So it's more than just the mammogram.
Okay.
They get covered free for a lot of
for the
women's
whole
health
process.
services.
So is the women's health, essentially the women's health whole health program?
Right. So their Well Woman check with a doctor, their mammogram, and then they're covered. If anything was found, they're covered across the board, and that's free. So, and if they don't qualify for Well Woman, then we cover them through our Catch It Early program.
Okay.
So one way or another, they're going to have that mammogram covered.
So we have so many different avenues locally, and that's pretty cool to have that in a town the size of Kingman. You don't find this in the bigger cities, at least not that I'm aware of. So it's pretty cool to be in a town that's growing like Kingman, to have this free mammogram program available to the public.
Exactly.
And on top of that program, you also have a new program you're going to start off here in the next few months on once a Saturday. The first Saturday of every month.
First Saturday of every month.
So what we're going to do then is we have a quick commercial coming up here in the next second or so. So we're going to talk about that new program you have, because it's pretty exciting from what I understand. It's a day of pampering.
Yes.
So if you're a woman, you can have a free day of pampering, all with getting your mammogram.
Right.
Okay, that's pretty exciting. So once again, stay tuned. After these messages, you're watching Your Health Matters. We've got Teri Williams with us. She's telling us how to get free mammograms for the ladies. And we're going to come back and we're going to talk about a day of pampering that's going to happen the first Saturday of every month. So stick around. We'll be right back. And one of those projects we have coming up is our 5th annual KRMC Mardi Gras. Hi, welcome back to Your Health Matters. I'm Scott Kern. Today we are with Teri Williams, the program director of our Catch It Early program, and we're having a great time talking about free mammograms. So in conjunction with the free mammogram program, Teri, what you're talking to us about before the break was a day of pampering for the ladies.
Yes.
Okay, so let's talk about this day of pampering, because I'm not going to lie, it's kind of making me jealous that you have to be a lady to be able to take advantage of this program.
Well, we're calling this day Time Out for Me Day. And we're aware that women in the community, there's just a lot of stress going on. There's women with their families, and certainly the financial stresses that are on all of us. Just a lot of stuff going on. And so we just want to create a day where women take time out to take care of themselves. And women are kind of known for putting everybody before themselves, and so we want to just give them a day where they can take time out and think about their own health, their own well-being, and so this opportunity is for women. If they call for a free mammogram, they can have the opportunity to come or schedule on the first Saturday of the month, and we will have representatives there from the Well Woman Health Check program, also with Access or the state Medicaid program. We'll have people there that for uninsured women or underinsured women, they can talk to those people about the programs and coverage through those programs. But then in addition to that, we'll have free refreshments, nice music. We're working on, and it looks like we'll have a masseuse to give back rubs. Cool. And then in addition to that, the Susan G. Komen Northern Arizona affiliate will be here, and will be providing education on breast health. They have a workshop that's called Breast Cancer 101.
That's very cool.
And for women to really learn about this disease and what they can do about it, what they have under control and what they don't have under control. But just to educate women in our community about this disease and how to take care of themselves.
Okay, so you said it's going to happen on the first Saturday of every month.
First Saturday.
Where is it going to be? That's a very important question. Not that I'm going to crash it, but I just want to know where it's going to be so we can tell the viewers.
It will be by appointment only.
Oh,
so
you have to be on the list.
You have to be on the list. It will be at the KRMC Imaging Center.
Okay, so it's at the corner of Sycamore and Western.
Yes.
Okay.
But it is by appointment because we do need to schedule them for the mammogram. And there's two other parts to this day too. Certain women in the community don't have a primary care doctor, which is common. I mean, unless you're sick, a lot of times you don't
think about it.
Right, you don't. Well, unfortunately, you can't get a mammogram unless you have a doctor to send the results to. So on these free mammogram, or on these Saturdays, we will have our new nurse practitioner, who is a women's health nurse practitioner.
Oh, very cool.
Her name is Lori Grant. She is brand new with us as a nurse practitioner, and so she will be there for women who don't have doctors, and she can do the clinical breast exam that a doctor does, and then can act as that woman's doctor, and she can get the mammogram that day, and then the results will go to Lori. So we've worked out a way that way also for women who don't have doctors and haven't gotten mammograms because they didn't have a doctor. We'll have someone there for them also.
Now, on a side note to that, I know Lori's new. She's been a nurse here at the hospital for a long time. She's just finished nurse practitioner school in Georgetown.
Right.
And she's coming back to Kingman to help. Yes. And she's going to be located at the Sunshine Family Practice.
Yes, I think it's called Kingman Family Practice now.
Okay, is it Kingman Family Practice? Okay.
That's on Wallapai Mountain Road.
No, okay. Is she on Wallapai Mountain Road or the Stockton Hill Medical Center?
We'll have to find that out.
We'll have to find that out. But Lori Grant, she is practicing in the community, so if a lady does sign up to use her as their primary provider, they can go see Lori also for the other health care needs.
Absolutely.
Okay.
Absolutely.
Fantastic.
They can see Lori for other health care needs, and then they'll establish a primary care provider. But they'll meet her on this Saturday, and they can get that. They can have her do their clinical breast exam, and then later on, if they want to follow up with Lori, that's great.
So since it's by appointment only, how do they make an appointment?
They can make an appointment by calling the KRMC Imaging Center at 692-2727.
So it's 692-2727. So ladies, if you're watching, 692-2727 to schedule your day of pampering and your free mammogram over at the KRMC Imaging Center.
And we also need to also mention that if there are women in the community who don't have transportation to come in for a mammogram, we're also providing transportation on those days. And so if they call and they need transportation, to please let the scheduler know when they call that number that they need transportation, and we'll try and arrange for transportation for them.
Okay, cool. That's fantastic. So this is a great program. So this keeps you pretty busy full time.
Absolutely.
I mean, you're running. I can attest to this because we work in the same office. You're running around constantly trying to improve this project and always make it better for those that have to use the services.
Right.
So some of your other duties that you do is you also help with the foundation and other projects that we do here at the hospital. And one of those projects we have coming up is our 5th annual KRMC Mardi Gras.
Yes, and it's coming up soon.
It's coming up soon. It's going to be here in a few weeks, February 28th, if I remember right.
Right. So
it's pretty exciting. You said this year's theme is Fire and Ice. We were talking in the pre-show. So it's Fire and Ice. It's the Mardi Gras, and it's going to come up on February 28th at 6 p.m. at the Wallapai Mountain campus over on Santa Rosa.
Absolutely.
On the other side of town.
And too fun of a party.
It is. We've come a long way from the first year downtown to where we're at now, to where we've got a great DJ. DJ Gene is going to come back. He's been there the past 4 years, and he does a tremendous job. We crown the king and queen of Mardi Gras.
Absolutely.
Your husband Rick will be there with off-Broadway photography to take some candid photos and some, I call them prom pictures.
Prom pictures.
So if you never got a prom picture, it's a great way to come and raise money for our nursing scholarship program.
And don't forget the food.
We've got a great food too. I'm actually really excited about the menu this year too.
Right.
The menu this year, I know we're having a carving station for the first time, and we're offering a carved turkey or sole stuffed crab. So it's a very tasty meal we're planning here. So,
but a little Cajun cuisine.
Oh yeah, well Mardi Gras is our theme, so I think we're going to have some Cajun spice in there too.
That's right.
We will be crowning the king and queen, correct?
Right.
So you have to be very festive to get into that. And ticket prices are. You told me that the ticket prices were $50 for single, $90 for a couple.
Right.
And we can do a reserve table for $350. Is that what it was?
$350.
Okay, that's fantastic. So that's February 28th on Wallapai Mountain Road, or the Wallapai Mountain campus over at 3801 Santa Rosa, which is the other KRMC campus across town.
Right.
So that's pretty fantastic.
And for more information, they call you.
They do call me. That's a shameless plug. It's my number is 681-8656. We can make sure you get tickets taken care of. Right. We want to see the entire community come out because this program benefits nursing education, which helps our nurses here at the hospital further their education, so we can get more women like Lori Grant to come back to the community and help us with this women's wellness program. With other various programs we want to get off the ground.
Absolutely.
I know
and we're educating our own.
That's
what's the important thing.
That's the important part.
It stays in our community to help our community.
And you have a very ambitious schedule. I know you want to put more navigator programs in for other KRMC services later on too, as we go.
As we go, and in fact we're launching, and there'll be more information coming out, but a lung cancer screening program. So I would tell people right now to be watching for information about lung cancer screening. It will be a dual project with Mayo Clinic.
That's fantastic.
And we're pretty excited about that. And so we're branching out and kind of modeling what we've done with breast cancer and using that in tackling lung cancer.
That's really cool. It's cool to see that we have a big time partner in the Mayo Clinic. Yes. And they're concerned for our local area too to want to partner with us on this lung nodule program. It's pretty fantastic.
It is.
Again, like our breast cancer program, this isn't something you're going to see in a lot of big cities either. It's kind of cutting edge, really, is what it is. So it's exciting to be on the ground floor as an organization.
It is.
To move forward and really see how this program can grow and how we can make it really work for the community.
Exactly, and it is. It's about taking care of our community and taking care of our own and doing what we can to help people that are in need. So.
Well, that's fantastic, Teri. I want to thank you for coming on the show today. It's been very educational. If you want to schedule your day of pampering, ladies, if you want to also schedule your free mammogram, you can go ahead and call the Imaging Center at
928-692-2727.
So 928-692-2727.
And I'd just like to urge every woman to get that mammogram. If you're nervous about it, if you're afraid about it, I can tell you that we're here to help. We're here to get you through that process and guide you through the way and take away everything we possibly can to help you out.
That's awesome. Thank you for being here, Teri. Thank you guys for watching Your Health Matters. We'll see you next time. Have a great day.